On strike over poor wages, working condition, among other related matters. Now, according to the doctors, this latest strike is as a result of the government's failure to meet their demands or agreed demands. Here's more details of that in this report.
A cloud of gloom has descended over the General Hospital in Kinshasa following the announcement of the strike. The doctors accuse the government of failing to fulfill a promise to increase their salaries and improve their working conditions.
Face à cette indifférence du gouvernement,
in the face of the indifference of the government, the Executive Office of the Doctors' Union informs all the provincial officers the following: the stiffening of the strike that was introduced last October because of the government's failure to respect the agreement we signed. We will hold a radical strike this Saturday, 28th December from 7:30 a.m. It will be held across the country except the provinces of North Kivu and Ituri because of the state of siege.
In October, the doctors went on strike over the same demands. Senior government officials held a meeting with leaders of their union and agreed to improve their pay and working conditions. But that promise has not been fulfilled, raising fears of a crisis in the health sector. The doctors seem to have the public's support.
It is like they're wishing us death. If doctors don't get their salaries, how are we ordinary people going to survive? Doctors can only treat us after their welfare is taken care of from their salaries.
Congolese doctors working in public hospitals receive about $480 a month. They want the government to increase that to $1,500 to align with the higher cost of living. The DRC is currently going through tough economic times, and they're being made all the worse by the government prioritizing military spending over critical sectors such as transport, health, and education. A war against rebels in the country's east seems nowhere near ending, and the government refuses to negotiate. It all spells bad news for ordinary people who need medical attention.
Millions of patients in public hospitals in the Democratic Republic of Congo will be deprived of urgent health care because of the doctors' strike. It has come at a time when the country is grappling with several disease outbreaks that have claimed many lives this year. Many patients hope the government will resolve the crisis soon.